The partial or total ankylosis of the hip joint caused directly by an injury or indirectly as a consequence of a trauma is a severe and permanent handicap for the subject concerned. This is due to the fact that, because of its special position at the connection point between body and leg, a not-functioning hip joint involves a permanent restriction in many fields of everyday life, above all at the working place, but also in private life. Ankylosis of the hip joint is usually painless, and the joint is stable, but in the long term, degeneration changes and pain will occur in the lower back of the hip and knee, especially when the hip joint has poor functional status. The pain may improve when a person moves around and be at its worst after sitting or lying down for a long time. Overactivity, like strenuous exercise, can also trigger these symptoms. There are various sorts of conditions that can influence the hip. Osteoarthritis. Osteoarthritis is the most common form of arthritis, affecting millions of people worldwide. It occurs when the protective cartilage that cushions the ends of the bones wears down over time. Hip is one of the most common body part affected by osteoarthritis. How to diagnose osteoarthritis? During the physical exam, your doctor will check your affected joint for tenderness, swelling, redness, and flexibility. Imaging tests. To get pictures of the affected joint, your doctor might recommend X-rays. Cartilage doesn't show up on X-ray images, but cartilage loss is revealed by a narrowing of the space between the bones in your joint. An X-ray can also show bone spurs around a joint. Magnetic resonance imaging, MRI. And magnetic resonance imaging, MRI, uses radio waves and a strong magnetic field to produce detailed images of bone and soft tissues, including cartilage. An MRI isn't commonly needed to diagnose osteoarthritis, but can help provide more information in complex cases. Lab tests. Analyzing your blood or joint fluid can help confirm the diagnosis. Blood tests. Although there's no blood test for osteoarthritis, certain tests can help rule out other causes of joint pain, such as rheumatoid arthritis. Joint fluid analysis. Your doctor might use a needle to draw fluid from an affected joint. The fluid is then tested for inflammation and to determine whether your pain is caused by gout or an infection rather than osteoarthritis. Trochanteric pain syndrome. Trochanteric pain syndrome, GTPS, is one of the most common causes of lateral hip pain in adults. In most instances, GTPS is due to a gluteus medius or gluteus minimus tendinopathy, with variable involvement of the regional bursae. How is trochanteric pain syndrome diagnosed? X-rays to rule out other conditions. Ultrasound or MRI to take pictures of the swollen bursa. Femoroacetabular impingement syndrome. Femoroacetabular impingement, FI, also called hip impingement, is a condition where the hip joint is not shaped normally. This causes the bones to painfully rub together. How to diagnose femoral acetabular impingement syndrome? During the physical exam, your doctor will closely examine the affected hip, bending, rotating, and flexing it to evaluate range of motion and determine which positions or movements cause pain. Diagnostic imaging tests are necessary to confirm FAI. These may include X-rays, magnetic resonance imaging MRI scans, and computed tomography CTT scans of the hip. Symptoms of hip arthritis. Some people have persistent pain, while others experience milder symptoms. Symptoms may flare up, worsen, and improve, go into remission, off and on. If you have ankylosing spondylitis, you may experience lower back pain and stiffness, hip pain, joint pain, neck pain, difficulty breathing, fatigue, loss of appetite and unexplained weight loss, abdominal pain and diarrhea, skin rash, motion problems. If you are a discharged veteran from U.S. military and looking for the compensation you can get for the condition of thoracolumbar spine, please check out our other video on thoracolumbar spine with compensation rating. Thank you for watching our video. Please don't forget to share, like, and subscribe to our channel.